So let's go to 13B, which is foreign objects. Now, foreign objects could be inserted into the nose, ear, eye, or swallowed.
Your casualty has fallen on broken glass and has some glass embedded in the wound. He is conscious and in severe pain. You have a fully stocked first aid kit available to you and there is no help available. What is your treatment? A. Open the airway and check for breathing. B. Leave your casualty and call for an ambulance. C. Shout for help, control the bleeding and treat for shock. Or D. Remove the glass and dress the wound before calling for an ambulance.
So, which do you think it is? Let's go for 13C, burns and scalds. Depth of burns, you've got three types. You've got a superficial burn. Only the outermost layer of the skin is affected. There's redness, swelling and tenderness. 5% or more must be sent to hospital. Partial thickness burn, there's rawness and blisters. 1% or more must be sent to hospital. 9% will cause shock. On a full thickness burn, the two layers of the skin, the epidermis and dermis, are burnt. This requires hospital treatment straight away. So, treatment of burns: flood the injured part with cold water for a minimum of 10 minutes. Gently remove any jewellery or wristwatches. Cover the area with a sterile dressing. Do not break blisters. Do not apply adhesive dressings. Do not apply lotions, potions, ointments or fats. Do not attempt to remove anything sticking to the burn.
Pete, quick, we need some first aid.
I'm so sorry. Over here.
Boiling water, was it? Come on, let me have a look at it. We'll soon stop that pain. Let's get it under the tap, get it under some cold running water. That's a good idea. Come on, we'll soon get it. Phil, I need you to get the first aid kit and some cling film. Quickly now. Yeah, so that gets a bit better. Some of the heat going out of it, yeah.
What's happened?
Shady, I need you to go and dial 999, ask for an ambulance, ask them to come quickly. We've got a young male, his lower arm has got a severe burn on it. Tell them where we are, and when you've made the phone call, come back and tell me.
Okay.
Come on, quickly now. Thank you. Ooh, hang on, he's going into shock. We need to lay him down. Help me to lay him down. Come on, gently now. Come on, down we go. Get him down. Get him down. Gently now, gently. Gently. Put his head down. Phil, I need you to go and get me a container and a jug with cold water in so we can keep bathing his arm. Okay. In the meantime, I'm just going to raise his legs, make him a bit more comfortable. Okay, let's have a look. Yeah. Well, you're okay now. Well done. We need to pour some water over it, get it from the tap, and then we can continue to cool the wound down. Just all over the wound, that's it. That better? Don't worry now.
The ambulance is on its way.
Oh, good. That's lovely, Shani. Can you get the mop and bucket and just mop up that spilled water, please, so nobody else slips over?
While the first aider is waiting for the paramedics to arrive, let's recap on the procedures to follow in a situation like this. The severity of scalds and burns can be gauged by their depth and the area which they cover. An area the size of a hand corresponds approximately to 1% of the body area. Casualties should be sent to hospital if they have full thickness burns. If partial thickness burns cover more than 1% of the body, or superficial burns cover 5% or more. Running cold water over a burn or scald reduces the heat and so relieves pain. The process should continue for a minimum of 10 minutes. The larger the burnt area, the greater the risk of the casualty going into shock, and it will almost always occur if the area is over 9% of the body area. If treatment for shock needs to be given and the casualty can no longer remain near a tap, cold water must continue to be poured over the wound by whatever means are possible. The water will warm up as treatment continues, so it should be regularly replenished with fresh cold water.
Right, the 10 minutes is up now. We're going to put a bit of cling film on, just in case there's any infection about. We don't want bacteria to get into the wound.
When the 10 minutes is up, the burn or scald must be dressed to reduce the risk of infection, with a burns dressing if it's large enough, but otherwise with a plastic material such as cling film. It shouldn't be wrapped too tightly, as it could constrict any swelling which might occur. The casualty should be kept warm, reassured, and their breathing monitored. After 10 minutes, cooling with cold water should begin again, with the cling film in place. Finally, once the paramedics have arrived and taken the casualty away, as always, the accident book must be filled in.
Your casualty has suffered a superficial burn covering approximately 1% of the body's surface. What is your immediate treatment? A. Cover in cling film and send them to hospital. B. Place the burn under running cold water for 10 minutes. C. Apply a sterile dressing in order to reduce the risk of infection. Or D. Lay them down and treat for shock.
So this is the first of the 3 types of burn: superficial burn, and it's covering approximately 1% of the body's surface. What would you do? Again, you can pause the video if you like to take your time. But let's go forward. Place the burn under cold running water.
What is the main risk of bursting blisters after a casualty has suffered partial thickness burns of 5%? Is it A. Causing further burns, B. A loss of body fluid, C. Possible scarring, or D. Risk of infection?
Again, which one do you think it is? What's the main risk for bursting blisters after a burn? Is it A, B, C, or D? Okay, 13D, bones, joints and muscle injuries. So the bones, joints and muscles are all part of the skeleton. The skeleton supports the muscles, blood vessels and nerves of the body and protects all the major organs. The muscles allow various parts of the body to move. The joints, this is where the bones meet. Ligaments hold movable joints together, and tendons hold muscle to the bone. The types of joints include ball and socket, such as in the hip, partially movable, such as the rib cage or spine, and immovable, which would be skull or pelvis. So definitions: fracture. A closed fracture is a broken bone that does not penetrate the skin. An open fracture is a broken bone which punctures the skin. A complicated fracture involves an injury to another part of the body, for example, a fractured rib and a punctured lung. With a closed fracture, you recognize it by pain, deformity, internal and external bleeding, shock, and a high risk of infection. Closed fracture treatment: immobilize the injured part, stop any movement, support the injured part, leave the casualty in a position found unless they can move the injured part to a more comfortable position, treat for shock, and call 999 or 112. Open fracture treatment: treat as for a closed fracture, control any bleeding and make sure you wear gloves. Apply sterile dressings around the wound. Do not apply any direct pressure on the wound. Complicated fracture: recognition, there'll be pain, deformity, internal and external bleeding, and shock. Treatment: treat as for closed or open fracture. Check the casualty for further injury or complications such as fractured rib, penetrating the lung, and treat accordingly. The human spine: this consists of 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, and the coccyx is at the base of the spine. And spinal discs, there are 23 altogether, and they are located between each of the vertebrae. These are the vertebrae, and this is the disc. And it acts as a shock absorber, stopping the discs, stopping the vertebrae actually grinding together. And how do you identify a spinal injury? If the spinal column is damaged, you'll get pain in the neck or back at the level of injury, a step or twist in the normal curve of the spine, and tenderness upon gently feeling the spine. If the spinal cord is also damaged, there'll be a loss of control of one or more limbs, abnormal sensations, for example burning or tingling, disorientation or bewilderment, and possibly difficulty in breathing. When treating a spinal injury, the certain things you must remember include: never move the casualty unless you have to. For example, if you don't move the casualty and something else could impact on them, then obviously that could make things worse, so you'll need to move them. But if there's nothing else that's going to happen to them, don't move them. Spinal injury treatment: prevent any movement, maintain an open airway, call 999 or 112. Dislocations: how do you recognise them? There's going to be pain, swelling, deformity, inability to move the affected area. And definitions of some injuries: soft tissue injury. Injuries to muscles, ligaments and tendons are often sport or activity related. A sprain: this is an injury to the ligaments surrounding a joint, possibly caused by overstretching or a sudden twist in movement. A strain: this is a tearing injury to the muscles and tendons, possibly caused by overstretching or too heavy a workload placed upon the muscles or tendons. And how would you recognise a soft tissue injury? Sprains and strains: there would be pain, swelling, bruising, inflammation, and cramp, especially with strains. Remember RICE, a procedure when dealing with a bone, joint or muscle injury. And that means rest the injured part, apply ice or a cold compress, compress the injury, and elevate the injured part. Make sure the ice doesn't go straight onto the skin. It must be in some sort of material.
You okay?
Hi, I twisted my ankle and it's really painful.
Did you want to go and get you a first aid?
Yes, please, if you would.
Okay, you just stay there.
Thank
I'll
you.
move this spot.
Thank you.
Jackie, you okay? What happened?
I've fallen on the stairs and really gone over on my ankle and hurt my ankle.
Okay, let's have a look.
It's so painful.
It looks like a bad sprain. Ashley, can you go get me a first aid kit, a towel and some ice, please?
Okay, will do.
Thank you. Let's lay her down.
Right.
There you go. Okay. Ashley, can you go and find me something to put under Jackie's leg so I can raise it for her, please?
Okay.
Thank you. Jackie, I'm just going to put some ice on your ankle there, just to reduce the pain and swelling, okay?
Okay.
Okay, what were you doing when you came down the stairs?
I was carrying a box down the stairs and I thought I'd be fine, but I slipped on one of the steps and twisted my ankle.
Oh dear. Why didn't you use the lift?
I never thought to use the lift.
Is that okay?
Yeah, that's fine. Thank you. Can you just hold that there
Yeah,
for
sure.
me, please? Thank you. You got anything planned for this weekend?
Yes, I think I'm going away at the weekend. Well, I was.
Well, it doesn't look too bad.
You don't think I've broken it, do you?
I don't think you've broken it, but we can't be too sure. What we'll do is we'll send you off to A&E, the hospital, just to get checked out, have an X-ray, so we'll know for sure then.
Okay.
Okay. Ashley, can you just help me put that box under as I lift Jackie's legs, okay? Sorry about that. Yes, a little bit of discomfort there, but we've got to do it to reduce the swelling, okay?
That's so painful.
Okay, I'm just going to check you for any other injuries now, Jackie, okay?
In this instance, the injury doesn't warrant calling for an ambulance, but it does require medical assistance. The acronym RICE is useful to remember when dealing with a soft tissue injury. R is for rest. The casualty should be encouraged to lie down. I is for ice. A cold compress should be applied to the injured part for around 10 minutes at a time. Never put ice directly on the skin. Put a towel or dressing on the skin and then put the ice on it before you apply compression. C is compression. By firmly compressing the ice on the injured part, swelling will be reduced. And E is for elevation. Swelling will be further reduced through the leg being raised.